Hello, this is Scott Jentz. Welcome to Sandbox Stories. Hello, welcome to this Sandbox Story, which is an interview with Dr. Linda Casser. Her optometry career saw service to 3 colleges of optometry, as well as the National Board of Examiners in Optometry, and concluded with being granted Professor Emerita status in August 2022 from Salus University, Pennsylvania College of Optometry. She's an author, a mentor, an industry leader, and someone I consider to having established the bedrock foundation for modern optometry. Dr. Casser, welcome to Sandbox Stories.
Well, thank you, Dr. Jentz, and thank you for all that you do and for the opportunity to participate in your Sandbox series.
Well, I appreciate you being here. Let's start with where you are today. What's keeping you busy? Where are you residing? How are things?
Well, as you kindly mentioned, I retired from Pennsylvania College of Optometry, Salus University in August 22. I moved back to North Carolina, to the home we had when I was with the National Board of Examiners in Optometry, headquartered in Charlotte. And I've been fortunate to stay involved with our profession through multiple volunteer committee roles, American Academy of Optometry, Association of Schools and Colleges of Optometry, the Accreditation Council on Optometric Education. I've truly enjoyed those continuing roles and the opportunity to contribute and to stay in touch with colleagues I've known for decades and just people I truly look up to and value. I'm also very involved in our church here in Belmont, North Carolina, and I just joined the board of the Homeowners Association for my neighborhood in December. So that's a new and different role for me, getting the opportunity to meet more individuals and to learn more about the processes behind our beautiful neighborhood.
I wish you could join the Homeowners Association of my board down in Florida. My goodness, use a rational thinker like you.
Thank you.
Let's start our optometry part of the discussion by talking about the National Board of Examiners in Optometry, or NBEO, part of your life. You were there for 3 years, starting in 2006. You were Associate Executive Director of Clinical Examinations. I know that your efforts really transformed the way that optometrists were tested for clinical competency far beyond what we used to do with state by state level. What is the evolution of the NBEO testing process on clinical processes led to in a more rigorous way? I have to guess you're very pleased with where it's gone.
Well, when I was with the National Board, again, you kindly mentioned my role there. I was responsible for Part 3 of the National Board, the clinical skills exam, also responsible for the patient assessment and management examination, which was part of Part 3 at that time, evolved into Part 2. And I was also responsible for the ACMO exam, the Advanced Competence in Medical Optometry exam, which was originally designed when the optometrists in the Veterans Administration approached the National Board to develop an additional credential that would allow them to progress within the VA merit system. I actually inherited the role from Dr. Chuck Hain, and I really credit him for working with Norm Wallace, Leon Gross to develop the clinical skills exam going back a number of years. I actually had the opportunity to serve on some volunteer committees that contributed to the development of that exam. In my role as with the clinical skills exam, we had a committee, we had an exam part council, talented individuals from around the country, and we really evolved the quality of the exam. So, for example, at that time, we had prescription writing on the exam, but we realized quickly that there could be a great deal of variability in how prescriptions are written for ophthalmic medications. And so we removed that because we realized it was difficult to score appropriately. We also were involved with developing the first injection skills pilot for Part 3. So I really helped to carry the baton from the wonderful work that Chuck Hain did. And I'm removed from that now, but my understanding is that Part 3 is undergoing a substantial evolution into less of a skills based, into more of a patient care based, but yet retaining key skills like slit lamp exam, BIO, etc. I applaud that because when I was with the national board and having had the opportunity to get to know some of the clinical skills equivalent exams in other professions, I was a little concerned. It's probably a stronger word than appropriate, but a little concerned that the board's exam was too skill based when the schools and colleges test skills rather than patient care based. So I applaud the evolution, not easy, but it seems to me from the going in the right direction.
Well, good. I mean, it's fair to say then that optometrists are being tested on substantially more involved levels of patient care standards and protocols than when you started 20 years ago, has taking it away from the states. Yeah, and I know there was, there still is, I think, a small number of states that do some testing at the state level. I'm not sure, but it's an improvement, isn't it?
Yes. I think anytime, especially in a profession our size, that we can embrace consistency, standardization, it's all positive. It's positive to meet the goals of the exam to protect the public, but it's also positive in the eyes of other healthcare professions. So, again, when I was at my position at the national board, the Part 3 exam, the clinical skills, was administered at every school and college of optometry, which worked well. It was a model in place for many years. It was helpful for the candidates, obviously, but I realized quite quickly that there was a fair amount of variability that would be ideal to minimize. Again, when the board moved to the centralized testing site in Charlotte, I had left the board by that point. I know it was not always embraced fully and for understandable reasons, but I think to bring the standardization is fairest to the candidates, fairest to the public, and projects well for our profession.
Very nice. I want to tell you about a 2016 article I found in Review of Optometry. It was an interview with industry stalwart Uncle Dr. Frank Fontana. And he
Mhm.
was reflecting on how his generation of ODs became more comfortable with advancing clinical care standards. And he said this in quote about you. So many great people made a difference to my generation of optometrists. Dr. Linda Casser was a wonderful teacher. She taught us about pathology and made us feel comfortable with it. I think a lot of newer graduates don't really remember or understand the effort that the profession took to bring all generations up to a care standard over the last 20 or 30 years. That must be something you're proud of.
Yes, but again, I was part of the system led by others. I was fortunate enough to complete one of the profession's earliest residency programs in Rochester, New York, at the Wilson Health Center under the leadership of Dr. Lou Catania. Wonderful mentor, wonderful educator, wonderful clinician. To me, truly transformed what we could do as a profession and what we should do therapeutically. I had the opportunity when I was a resident to work with Dr. Murray Fingerette, who stayed on the staff after he completed his residency there, as well as Dr. Ted Woodcomb and Dr. Barry Thorne, one of the staff optometrists. So as I had the opportunity to learn from them, as well as Dr. Ron Reed, the wonderful ophthalmologist who worked with us as the consultant, we were the entry level to eye care at the health center. I had the opportunity to be involved in what they were involved with. So at that point, late 70s, early 80s, continuing education opportunities were very prevalent because obviously, as you well know, Scott, our profession was transforming. Many states were embracing therapeutics. Sometimes the state laws had a required continuing education component in order to be certified. And I had the opportunity to do continuing education lectures. So, again, I was part of a movement, I think, just a small part that I truly enjoyed, had the opportunity to meet wonderful colleagues all around the country and internationally, and grateful for the comments of Dr. Fontana, who I truly looked up to as a leader and a mentor.
And I think the profession is better because of the effort that was made on that state by state continuing education mission that you and so many of those colleagues that you mentioned were a part of. I'd like to go back before that to your even earlier days. Tell us about where you were brought up and what your family was like, because you must come from those that wanted to help others, given what you've done in your career.
Mm. So my parents were from Racine, Wisconsin. My dad was in the Navy. He was a Navy pilot. I was actually born in Pensacola, Florida, and the Naval Hospital there. He was then transferred to Hutchinson, Kansas, and then to Maine, Brunswick, Maine, where he flew planes between Iceland and Maine looking for submarines. Then he and my mom and myself and my younger brother returned to Wisconsin. He went to law school at the University of Wisconsin-Madison. And then we moved back to Wauwatosa, Wisconsin. He was a patent attorney at a law firm in downtown Milwaukee. My mom was a homemaker. And I would say overall, I remember my dad working late nights as a partner in a law firm. And I would say both my parents definitely instilled in me a passion for learning, a passion for education, and a passion for finding a career path that would hopefully make a positive difference.
We've never talked about this, but you've piqued my interest. What law firm was your father at?
Quarles, Harriet, and Brady.
Quarles and
Mhm.
Brady, a
Yep.
longtime supporter of the Wisconsin Optometric Association, was
Oh, good.
Q&B. And my uncle was an attorney in downtown Milwaukee at Foley and Lardner, probably similar timing. It's really interesting.
Great, great. Thank you for that common ground.
Who ended up influencing you toward optometry? You are a 1978 graduate of the Indiana University School of Optometry. How did you get that motivation?
So I went to Northwestern University undergraduate. I was a chemistry major. Fall of my junior year, I realized what I didn't want to do and wasn't sure what I wanted to do. So, holiday break of my junior year, I went to the local branch of the University of Wisconsin, Milwaukee, went to like their career counseling center, was looking through the government's occupational handbook, and I turned to the health professions section. And I'm looking through page by page, and I come across optometry. I had had one eye exam at that point by in a doctor of an ophthalmologist's office. Copied the optometry page, took it home, showed it to my parents. My dad said, "There's an optometrist in my law firm building, Dr. Sidney Nelson."
Anything
So
else?
he arranged for me to go visit his practice. As I'm sure you know, Scott, beautiful practice. Caught caught the bug, very excited because to me, like so many of us, it blended my interest in science with helping people and being a healthcare provider, but perhaps different from medicine, dentistry, etc. So I applied to the Ohio State University College of Optometry, Indiana University School of Optometry. I was accepted to IU. I actually did my interview in Evanston. A local optometrist interviewed me in Evanston, Illinois. I got accepted to IU, but I'd actually never been to the campus. So back then, Bloomington, Indiana was had an airport that accepted commercial flights. Normally, my parents would have driven me to campus for my to be enrolled to matriculate, but they weren't available. So I flew into Bloomington. It was the literal and figurative unknown because I knew very little about our profession compared to I think current applicants and current new students, but just had the best experience, wonderful mentors, wonderful classmates, truly, truly enjoyed what I was learning, and both personally and professionally was the very best decision I ever could have made.
What a great story. Dr. Nelson was one of a couple of choices I had coming out of optometry school for the future of my profession. I didn't go that way, but what a wonderful human he was.
Yes, agreed, agreed.
Let me just step to the side for a moment about your time at IU. That's where you ended up meeting your future husband, Keith. Tell us
Yes,
about the life the two of you had together.
yes. So when I went to IU, again, a lot of unknowns. I just signed up for dorm housing. That was a bit of a disaster because I was the equivalent of a senior surrounded by freshmen. And in a normal way, there were occasional shaving cream fights in the hallways, water balloon fights. It was a bit of a mismatch. So, my second year in optometry school, I transferred to what IU then called the Graduate Residence Center. It was multiple buildings of graduate students, most of which were co ed, meaning they had a women's and men's wing. So I met Keith Locke, my dear husband. That would have been summer of 75. I heard about a dorm room party in my building, Weatherly Hall, went to the dorm room party, met Keith. There was an instant dislike. He heard I was from Wisconsin. He made some weird comment about cows that happily I don't really remember. And we really didn't hit it off. Well, since this dorm had a men's wing and a women's wing, there was a central lounge where occasionally, residents would gather. There was a common cafeteria. So we crossed paths in summer of 76. I was working at Taco Bell in Milwaukee, and I got a call from Dr. Dan Gersman, a wonderful mentor who taught optics courses at IU. He said, "We need to offer a remedial optics course. Would you come be a TA?" And I had been a TA in the past. I said, sure. So went back to Bloomington, lived in a different graduate center dorm, graduate residence, and Keith and I crossed paths and just hit it off. So summer of 76, we dated for 6 years, thanks to me, because I, with the residency, wanted to put some roots down as a professional. He was very understanding about that. We married in May of 82 and cannot have had a more wonderful husband. He was intellectual, he was cultural, he loved to travel, so introduced me to international travel. He, in my book, was an honorary optometrist. He loved our profession. He supported me unconditionally. By that, I mean volunteer roles, which he often partook of. So when I had the opportunity to be president of the Indiana Optometric Association, he became the first male president of the auxiliary, which was then the American Foundation for Vision Awareness. As I made my various career moves, which were not always planned purposefully, but opportunities arose, he was president of a telecommunications company headquartered in Indiana. So fortunately, as he supported me in making my moves, he was able to be flexible, especially as a telecommunications company, that he could move with me and then travel back to Indiana on a regular basis as the president of the company. So just a wonderful life, could not have been more fortunate, and truly, 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 I could not have accomplished what I did or had the opportunities that I had without his love and support.
Yeah, bless him.
Thank you.
Well, tell us a little bit more about this residency. It was a 2-year residency. Is that right?
Yes, correct.
This was breaking ground. This was new in optometry. I think that today graduating classes are upwards of 20% of students doing residencies. Is that number even close to right?
I believe that's true. Again, I'm not close to the data currently, but
Right.
I believe you're correct. Mm-hmm.
What motivated you to do that? I know you talked about Dr. Catania. Was it suddenly you felt this urge to be involved in academia?
So when I was a student, the disease component of, I was an optics TA, I was a TA in the low vision course at IU, and really enjoyed those opportunities and the teaching aspect of it. I also really enjoyed the disease component of what we were learning. And I think it's fair to say, as a member of the class of 78, we were kind of on the front end of having systemic disease, pharmacology, ocular disease as key components of our curriculum. We were using Schiot's tonometers back then. We were using tangent screens. And I had an opportunity in summer of 77, so the summer between my third and fourth year, to go to the Cleveland VA Medical Center. And I believe I was one of the earliest optometry students to have an externship at the site. This was a volunteer rotation. worked with wonderful optometrists there, wonderful ophthalmologists, and it really fueled my interest in doing a residency program. I believe Dr. Catania's residency was the second one in our profession behind the Kansas City VA and David Amos. Applied to the program, went to the Wilson Center, which was one of the early health maintenance organizations in Rochester, New York. Just loved the setting, loved how optometry was fully embraced within the healthcare model. As I mentioned previously, optometry was truly the entry point into eye and vision care in the health maintenance organization. Interestingly, if I may tell a story, I didn't think I would be accepted into the residency. And interestingly, I was told at one point during the application process that that person wasn't sure a woman could succeed as a resident, which was interesting, but I didn't let it fade. I actually didn't think I would be accepted because I found it to be such a great opportunity and I wasn't sure that I rose to that level. Well, Lou was lecturing in Chicago in March of 78. And we hadn't met at that point. And he said, "Why don't you come to my lecture and I can meet you?" I said, "That would be great." And I offered to drive him to O'Hare Airport. Well, at that time, I was driving a used 1969 Firebird convertible stick shift 350 horsepower engine. And I drove Lou to the airport in that car. Well, so that was March. I interviewed in Rochester in April. I was accepted, started the program July 1st. A few months in, I said to Lou, I happened to mention to him, I wasn't sure I would actually be accepted. He said, "When I saw you in that car," he said, "I knew you were in." So I like to tell people as I've shared that story, you never know how first impressions are going to impact things. So I hope you don't mind me sharing that, but it's one of my fond memories. And Lou and I laugh about that on a regular basis.
If only for a photograph.
Well, I have a picture of the car. It's beautiful. It was a beautiful car. But
You-
speaking to the residency, and not to make too light, but I just, I treasure that memory. But a wonderful, wonderful residency. And knowing Lou and people he worked with, Murray and Barry and Ted, no surprise. So we were the front line in the eye care services. SUNY in New York City was the academic affiliate under the leadership of Dr. Irv Suchoff, director. Lou built in components to the program that truly made it a primary care experience. So there were four of us, two first year, two second year residents. We went to SUNY every fourth month, stayed at the 92nd Street Y, took the subway to the college. We spent a month in low vision with Bruce Rosenthal and Roy Cole. We spent a month in contact lenses. We spent a month in vision therapy, binocular vision. We spent a month in ocular disease with Jerry Sherman and Sherry Bass. Truly broad scope. When we were back in Rochester, we were on call. We put in a lot of long hours. Lou built in an educational component to the program. We also did low vision locally in Rochester. Murray Fingerett was heavily involved in that. We also did work at a local center that helped to care for individuals who had developmental challenges. So I truly value the breadth of what I learned as a resident, including the therapeutic component, as we mentioned earlier.
I don't mean to overstate it, but again, developing what I consider the bedrock of modern optometry is truly these experiences all of you were taking from one another. It's fascinating. You ended up at the beginning of your career as an assistant professor at PCO. Did somebody influence you to get there?
Yes. So if I may again tell a personal story. So 2 years, intensive program, wonderful mentors. When I finished the program, June of 1980, I felt on top of my game. I felt on top of the profession. Still a lot to learn and a lot of experience to gain, but I really felt I had a good handle on things. I interviewed at 3 optometry programs. When I interviewed at one, they knew what we were doing in Rochester. They knew about our therapeutic efforts. They literally said to me, we don't want you here because we don't view that to be part of optometry. So interestingly, I didn't realize that I might run into that perspective. And I understand that. And to me, that's the normal evolution of a profession over time. But I didn't expect it. So PCO, Pennsylvania College of Optometry, was a wonderful opportunity for me. It was a golden era for PCO, in my opinion. Norm Wallace had spearheaded the construction of the Eye Institute in North Philadelphia, which my understanding is the first federally funded freestanding optometry clinic in the United States, optometry school affiliated clinic. It was multidisciplinary. We had a module design. I was chief of one of the primary care modules. Each module had an ophthalmology consultant who would come in a half day a week. We had a very active residency program. So in my module, we had a pharmacy on the lower levels, staffed by a pharmacist, and very talented specialty clinic leaders. Randy Jose, low vision, Lenny Press, binocular vision, VT. So it was truly multidisciplinary. And we had the great fortune of the unconditional support of Dr. Joe Toland, who was a graduate of PCO and then went on to medical school. And we were able to prescribe therapeutics under his license, under standing orders. We also had a wonderful retina specialist, Ed Degland, who came into the Eye Institute on a regular basis to consult with their patients. And I think you're well aware, Scott, in that era, the early 80s, ophthalmologists who stepped forward to collaborate with us sometimes took a lot of political heat, and that from their colleagues. And again, I understand that. To me, it's a normal evolution. It's something that happens when perceptions don't match reality and people don't take time to get to know each other as professionals and see how we can contribute to patient care. So they experienced the heat, but held firm, golden era, and just truly enjoyed the opportunity to be a PCO at that point. It was a great match for me for my first faculty role, 1980 to 1984. Lou transitioned to PCO from Rochester, I believe about 1982 or so. So he was at the Eye Institute. He and I also had the opportunity to teach some elective courses together on anterior segment disease. So it was a wonderful carry on from the residency program in which I had a chance to have him as a mentor.
And it was also a golden age for optometry. The point you make about the advancement of the profession, the education process had to evolve. So for 13 years thereafter, you end up back at your alma mater at Indiana University's School of Optometry. What were the first feelings when you got back there?
Well, again, I was fortunate to get a call from Dan Gersman, who was my mentor in the optics courses. As you well know, IU is headquartered in Bloomington, and the school had established its first Indianapolis clinic in 1976 under the leadership of Jim Hunter, the Illinois Street Eye Clinic, with the understandable goal of expanding the patient care experience for the students. And the school had made a decision to open a second Indianapolis site. Back then, and that's changing this summer, it was a joint campus of Indiana University and Purdue University at Indianapolis, IUPUI. Indianapolis was undergoing urban renewal. The campus was part of that. There was a building on the fringe right across the street from the campus, the Walker Building, which was built by Madam C.J. Walker in the 20s. Madam Walker was the first self-made African-American millionaire through hair care products and cosmetics. So this was her manufacturing building and headquarters. So the school established the Walker Eye Clinic, which opened in October 1984. So I was fortunate to be asked to serve as the director of that clinic, which I truly enjoyed because I felt confident that I was prepared to do so clinically. I'd had administrative experience at the Institute as a modules chief, and I loved the experience because it was, for me, like being in a practice, but yet with an academic affiliation. We were 50 miles away from campus. It was a new clinic, so we had to forge some new ground, had wonderful staff members and wonderful faculty colleagues with whom I worked in order to do so, gradually built the clinic. And then in 1991, a decision was made to merge IU's Illinois Street Eye Clinic with the Walker Eye Clinic and build the Indianapolis Eye Care Center, which opened in a brand new building, again, on the fringe of the campus in November of 92.
Is that Walker building still in Indianapolis?
It is, yes, it still exists. I drive by there every once in a while when I visit Indianapolis. I'm not actually sure how it's being used right now, but yes, still exists. And there's a sign at the top that says Walker Theater, because on the top floor, I believe, still is a beautiful theater in the building.
What a great story. So the next step takes you out west. You end up going to Pacific University College of Optometry. You were associate dean for academic programs and professor. What took you that direction?
So I had set my sights on continued opportunities within optometric education. Back then, there were fewer schools and colleges, so sometimes that meant a move geographically. And again, as I mentioned, I was just truly fortunate that my husband was open to those opportunities and for making the geographic moves. And a position opened in Oregon, as you said, the Associate Dean for Academic Programs. And I was ready to make a shift. I had been a clinical educator, an educational clinician for many, many years, and I was ready to make a shift into academic administration. So that opportunity opened up. It was a brand new step for me. Learned a lot, worked with wonderful faculty and students there, many of whom are still dear friends to this day. And it was a wonderful opportunity, being from the Midwest and spending a lot of years in the Midwest, to really become familiar with a different part of the country, and truly, truly enjoyed it. I was there for 8.5 years.
Another place where our lives somewhat touched was my former partner in practice here in Madison, Wisconsin. Dr. Peter Bergenski ended up leaving our practice to go join you and be part of the team there. Such a wonderful expert in the world of contact lenses and optometry. And I know he was thrilled to be there with you.
Yes, thank you. And got to know Peter and his wife, Cheryl Bruce, and became fast friends. And yes, one to work with, just terrific people. Thank you for the reminder of that common ground as well.
So by 2009, you were back at PCO. You had achieved the role of dean, and then you were also interim associate dean for the practice of optometric medicine. What's really compelling to me is how you leveraged all of your background in multidisciplinary care to bringing that where Salus University was involved in multidisciplinary or interprofessional education. Tell us a little bit about your passion for that as it developed.
Yes, so as you kindly mentioned, I went from Oregon Pacific to the National Board. And in summer of 2008, PCO founded Salus University. It was granted university status, I believe, July of 2008. And understandably, then the university and the college was undergoing administrative changes. And Dr. Tom Lewis, the president at the time, contacted me about applying for the deanship at PCO. And I was very excited to apply for that because I had really set my sights on a dean's position if those opportunities presented themselves. I was very excited about the opportunity because I had been at PCO in the early 80s as a single purpose institution. I went back to PCO January of 2009, almost exactly 25 years since the time I had left. And I was enthused about that because I had lived optometry in university settings. So I thought I could be helpful as PCO founded this brand new university. In addition, it provided, as I believe you just referenced, a great opportunity to work with other professions. So at that point, even pre-university status, Salus had an audiology program, a physician assistant program. So after I completed my 5-year term as dean, I had the opportunity beginning in 2012, so about a year before I finished my dean's position, to become involved in interprofessional education at Salus and at the national level. And truly, truly enjoyed that. It was perfect timing, I think, to infuse a fresh perspective and new opportunities, both locally and nationally. I truly enjoyed getting to learn about other professions at a deep level and helping to facilitate the professions working together on our campus and helping to be an ambassador and messenger for our profession at the national level as well.
For a period of time, I saw a title you had carried of Coordinator of Interprofessional Education for Salus University at Elkins Park, Pennsylvania. The OD and you leveraged your relationships, your knowledge to advance that. What was that like?
Very exciting, not easy, which all interprofessional issues is the case. So we formed a committee. We had multiple initiatives. We created an interprofessional continuing education course. Again, as you kindly mentioned, I had opportunities over the years when I was an active clinician to do many continuing ed lectures, but I was always looking forward to innovation and created a model with all the professions on Salus's campus around the table with a structured format. We would first describe, say, in the care of a patient who has diabetes, we would first describe from a uniprofessional standpoint how each of us contributes to the care of a patient who has diabetes. And then we would role model a case discussion, case management of a patient. And when we'd come up with a fictionalized patient and discuss how we would care. So that was one of our major initiatives that we did in multiple settings, including at the national level. We formalized our evidence-based practice course, which is in the fall of the first year for most of the professions on the campus. We developed a pilot for an interprofessional clinical problem solving course. Most of the programs on Salus's campus have a small group case-based course called clinical problem solving. So we developed a pilot for that at an interprofessional level. And one of the projects that I was very excited about, but like so many things, unfortunately, COVID got in the way and some other challenges, is we developed a model for an interdisciplinary screening. Now, we can all debate the value of screenings versus comprehensive exams, but what enthused me about this screening model is this team developed it with representatives from each profession on our campus, is we envisioned each of us having a piece of this screening, not that we're in separate corners of a large room doing our own screenings, but it was an interdisciplinary integrated screening model. We even included questionnaires, elements on oral health, because I'd become involved in dental accreditation by that point. So it was very broad-based. What we were getting into the early discussions about was the supervision of the students, because we envisioned every student doing the same screening from start to finish. But who would supervise the students? And Scott, I'm sure you're aware, sometimes the state laws prohibit, say, an audiologist supervising an optometry student. But we thought for a screening, as opposed to patient care, that we could introduce interdisciplinary supervision as an exciting element to this. And I think it would have been a great model for Salus and really set Salus apart. And again, that's not to say that I was naive enough to think that once our students graduated, if they were an audiologist or an optometrist or a physician assistant, that they would necessarily administer the screening when they got into practice, but that through this process, they would gain greater insights into their fellow professions, if only from a co-management referral standpoint. So I was very sorry that we never got that off the ground, but I have shared that model with others, and we did multiple poster presentations about the draft we had put together and got really good reception at the national level. And again, if I may mention, I had the opportunity to be involved with optometry in Australia over many years, and the licensing board asked me to be involved remotely with one of their strategic planning sessions in February of 2020. So I did a PowerPoint remotely, talked about our interprofessional efforts because they have very strong presence of interprofessional education in their accreditation standards. And I shared this model with them. I said, please keep it confidential because we're still working on it at that time. And one of the participants piped up, he said, we're already doing that in Australia. So again, I would love to see innovation whenever possible. One of the many things I learned during my work in interprofessional education and interdisciplinary practice was, and I heard this at a meeting that I attended at the Institute of Medicine, what was the Institute of Medicine at the time in Washington. Someone said, even small projects matter. And I agree with that 100%. Make it manageable, opportunities for success, because every interprofessional project, I think, makes a positive difference.
Right. And I mean, you're planting seeds of not only the importance of an individual patient's healthcare outcome, but you're making an effort to change the way that health equity outcomes can be an important part of what all of us do, understanding our role as part of a larger team. It's wonderful.
Yes. And I think, Scott, what you know far better than I as a practitioner, I think what I saw happen over the years of my involvement was that all the health professions education programs embraced interprofessional education, IPE, but translating that to clinical care, I think there's still a lot of room for effort, if only from the standpoint of reimbursement for interprofessional care. So again, lots of good opportunities. My hope is that optometry is at the table.
Yeah.
So important.
You've been deeply involved throughout your career with the American Academy of Optometry. Many of the people you've worked with and those that have mentored you are a list of people that have been the same. You ultimately were inducted into the Hall of Fame of the Academy in 2022. What impact on your career came from being alongside these fellows, not only teaching them and learning from them? It's an important organization.
Full agreement. Yes. Can't speak more highly of the Academy, as I know you know, Scott, but I became a fellow in 1984, attended every meeting. Actually, I attended my first Academy meeting in Boston in 1978 when I was at SUNY for the residency program. I went to Boston for the Academy, attended every meeting since then, except when I had a health issue that prevented me from going. Just can't speak more highly about the quality of the organization, the quality of its annual meetings, and the quality of the people involved. So over the years, I had opportunities to be involved with the Academy. I was involved in the founding of what was the primary care section in 1989 under the leadership of Felix Barker at PCO. Felix had a wonderful vision that I totally supported and agreed with. So I became a fellow in 1984. I wanted to progress through the academy, perhaps pursuing a diplomate program, but as a primary care optometrist, there wasn't a diplomate that fit for me. I view primary care optometry to be an expertise of breadth rather than depth. So back then, I believe the cornea contact lens section very active, but that wasn't a good fit. Again, I did a lot of binocular vision, low vision at the primary care level, but I didn't feel I could succeed as a diplomate with their level of expertise. So Felix put a group of us together in 1989 to develop a proposal for the primary care section. It was myself under Felix's leadership, Stephen Chun from Berkeley, Ann Clark from Arizona, Jeff Megan from South Carolina, and Doug Hopkins from Indiana. Wonderful group of colleagues. We got a little rebellious at times. ran into some obstacles, but ultimately succeeded thanks to the support of the Academy Board. And as you probably know, that section morphed into now the Comprehensive Eye and Vision Care section, which this year marks the 35th year of the founding of that. I also had a wonderful opportunity beginning in the early 90s of being involved with the Academy's leadership program and leadership committee, which Mert Flom spearheaded. He saw a need to help cultivate leaders within the Academy, within our profession. So names we all recognize: Rick Weisbarth, Carla Zadnick, Barbara Caffrey, Sally Dillahay, Julie Shornack, Steve Eiler from North Carolina, and I could go on and on. Peter Bergenski, he and I co-taught a course at one point, a component of the leadership courses. So just a wonderful opportunity to have great role models, mentors within the Academy. Had the opportunity to provide a few lectures occasionally, posters, and currently I have the great pleasure of being on the Hall of Fame committee for the Academy under the leadership of Bernie Dolan. So one of those committees that I'm honored to continue to be part of, even post-retirement.
It's not mutually exclusive to be involved in the Academy and also our advocacy organization, the American Optometric Association. You've been involved in AOA committee work over the years, and I know you were deeply involved in Indiana's Optometric Association as president, and also at Pennsylvania's association and the Oregon Optometric Physicians Association. What can you tell our audience to help them understand the power of performing those volunteer duties in addition to what you did academically with the Academy?
So again, a quick anecdote. So as I mentioned previously, and you were kind enough to, when I was at IU as a faculty member, I directed clinics in Indianapolis for the school. The Capitol was blocks away from the clinic. The governor, again, not to violate HIPAA, but the governor at that time and his wife were patients at our clinic. Happily, things have changed. And to me, as I've referenced, it's the normal change over time, normal broader awareness. I lived through a time when academics weren't always fully welcomed into the state society, the local societies and the state association. And I lived through a time when fellow faculty members saw involvement in the state association and local society as maybe not quite compatible with being a faculty member. Happily, that changed. It's so wonderful. I am always so thrilled when I see faculty members so actively engaged in state associations and become presidents. In fact, I attended the spring convention last month of the Indiana Optometric Association because one of my former students at IU, Dr. Jeff Parati, became the new state president. I was honored to be there for his induction. But that didn't deter me. And frankly, I was a little oblivious to that, which is probably a good thing. So it was just natural for me, especially as I went back to Indiana in 1984, to become involved, to meet more people. And I truly believe that states that have a school or college of optometry, that is an invaluable relationship that has to be cultivated and strengthened. And to me, that's mutual familiarization, communication awareness, involvement of faculty, and the reverse, involvement of practitioners, state leaders, state executive directors with the school or college. And happily, in the states I'd had the opportunity to be part of, Indiana, Oregon, Pennsylvania, that was a model that was very much embraced. Again, not always early on, but happily evolved very positively.
I'm glad you were there.
Thank you.
And if that wasn't enough, you also got involved with ASCO. You were on the board of directors. And I don't think most that are listening that aren't involved in education understand how this Association of Schools and Colleges of Optometry is a bunch of collaborative competitors, maybe is a good way to say it. I know you're not actively involved in it today, but given your history there and across all these colleges, do you have a little bit of perspective as to what's ahead for optometric education you might share?
Well, as a quick foundational comment, ASCO, the Associated Schools and Colleges of Optometry, is being a dean or a president means you're a member of the board. And one of the many things I value about ASCO is not only the board, you're right, it's friendly competition, but yet, especially given the size of our profession, the opportunities for communication, mutual awareness, sharing best practices is essential. And what I also truly value about ASCO is its committee structure and its special interest group or SIG structure. So, as I'm sure you and listeners are aware, it brings together the clinical skills faculty, the clinical methods faculty, the binocular vision faculty, the interprofessional educators, the practice management educators. I think one of the best initiatives ASCO has done is the Summer Institute for Faculty Development, which again, I had an opportunity to be part of at its inception, along with David Heath, Carla Zadnick. Wonderful initiative every 2 years to help young faculty succeed in the academic arena. With regard to your actual question, and again, Scott, it's interesting now, having been retired for almost 2 years, to be at the stage of life to look back on my career rather than forward. I do feel, like many others, that I can function as kind of a statesperson perspective in a constructive professional way. But I think long and short of it, and I've had these conversations over many years with Dr. Ann Hoshite, one of our dear friends and colleagues, who has just been a phenom within our profession. I believe there's room for innovation in optometric education. And I believe without one organization dominating or being the elephant in the room, to have civil discourse, even if we disagree, because I believe our profession, like all, needs to take its future and approach it very purposefully. And I've actually seen that, not at a deep level, frankly, but I've actually heard about that, it's the better word, in other professions as I've been involved in interprofessional education. And I'm not so sure that our profession has done that globally. So I think there's room for innovation. There's absolutely room for us to continue telling the world who we are and what we do, to attract student applicants, to attract administrators, to attract faculty members. So I'm hopeful that others will carry those conversations forward.
Yep, so too. I want to ask you about mentorship. You mentioned Dr. Ann Hoshite, another one of my past guests who spoke so wonderfully about how she felt you mentored her. I know you've mentioned a lot of people you've worked with. You don't have to mention them again. And it's always a fear that you're going to leave somebody out. But is there somebody that, or two, that you feel like really influenced you? Because I know you feel strongly about the importance of being a mentor. Did somebody plant that seed to you?
I would have to say I was a little more oblivious early on than I should have been, frankly. And it's really as the years went by and had conversations like these with you and dear colleagues and talented folks like Ann Hoshite and the leadership courses in the academy, that I really gained a greater and more appropriate appreciation. So I would really have to say, again, you're right, we could all list countless names and we would risk leaving people out. But I would have to say it really was Dan Gersman at IU, who brought me into the teaching to teach as a TA and recruited me to go back to IU as a clinic director. Lou Catania, without a doubt, as my residency mentor and really facilitated my career in countless ways. John Amos at UAB also was a great supporter of me within optometric education and as a woman in optometry. He's one who comes to mind to me, who realized late 70s, early 80s that things were changing and to help engage others in the profession.
And I think Dan took you out of Taco Bell.
Yes, he did, happily.
Thanks for the segue in your last statement. The last thing as we wrap up, I want to ask you about is a 2020 opinion piece you wrote for the journal Hindsight, the Journal of Optometry History. I think this is an important topic for us. Those of us in the eye care profession that thought the year 2020 would be a great one where we could tease out the relationship of 2020 of our profession to the year got sideswiped by the pandemic. So, early in that year, you wrote what was a retort to a 1983 article called Will Women Ruin Optometry? And the subtitle was Experts Ponder the Impact of Female Doctors.
Mhm.
It seems to me that, you had captured some wonderful thoughts about that. We all know the profession's better for the involvement of all genders. Women have made a difference. And today at ICO, where I sit on the board of trustees, 72% of incoming students are female. It's a profession rich with the support and contributions of women. What are your thoughts as we sit here in 2024, reflecting back just those 40 years on that article?
Well, again, not to sound shocking, and I believe I mentioned this in the editorial, and I might mention, if I may, Scott, that I sit on the Optometric Historical Society Committee for the AOA, and Dr. David Goss has just transitioned after 30 years as a wonderful editor of Hindsight, and he had decided to do some theme issues about women in our profession and kindly asked me to provide the editorial. And I think I even mentioned in the article, this may sound shocking, I actually didn't think much about gender. It just wasn't in the forefront. And it wasn't until years later, as I heard feedback from more junior female colleagues, that I realized that people notice those things. And sometimes it's very important to others. So to me, happily, our profession has reflected changes in society with gender diversity, as I also mentioned, and as we all know, we also need greater diversity in our profession in other areas. And happily, a lot of folks are working very diligently on that. But I think what's interesting, just thinking back, is having lived through that 40 plus years, in 1983, Will Women Ruin Optometry? And the tone of the article was, we're going to invade the profession. There's going to cause a lot of flack in the profession. The anonymous sources were quoted. It was fascinating. It's fascinating to read that article and then fast forward 40 years, as you referenced, where we are today. And even the AOA having one of its online articles I mentioned in the editorial, The Future is Female. So it's interesting to have lived long enough to see that transition, to applaud it, to have been mentored and seen role models of women in our profession. Countless names come to mind, and then hopefully to have contributed to it. I think the one thing, as in the last few years at PCO Salus, I taught in and coordinated some of these clinical problem solving courses, these small group case based discussions, which I loved. I think what I would encourage every student is not only to be fully engaged in the curriculum, but to also develop strong communication skills and strong confidence skills so that we project well to our patients, to other healthcare providers, to family members, and to develop the confidence, as you say, Scott, to be great at all that we do, because our profession has always done that. Our profession has to keep doing that, in my opinion. So that's my hope, is that we all continue to stand on the shoulders, irrespective of their gender, and continue to move our profession forward.
Yeah, I mean, we reflect back on your story about Dr. Catania really understanding that you were going to be an important part of that residency program, regardless of the car you drove, but that there are different ways generationally that we see women get their consideration and due. And we don't have to look at it through that lens, but if we do for a moment, particularly those that it's important to, we understand that not only is gender equity, but all other forms of inclusivity an important part of optometry's future. And I'm glad that you've
Yes.
shared those stories to impart the next set of inertias on those that follow us.
Mhm. And I think you kindly referenced this earlier, and I don't think I actually spoke to it, but you're right. I think it's always good to remember our history and where we've come from. But I think it's normal that we don't always do that, but it's really good when we do, to honor those who have come before us, but also to remind us how we got to where we are and how we need to move forward.
Well, I'm sure many will want to cross paths with you at a future meeting, but if they don't, where would they find you? Hiking on a trail somewhere or on a plane to another country? What are you going to do in the coming years with some of the time you've earned for yourself?
Well, thank you. I'm hoping they would encounter me on either a cruise, love to travel. Again, my husband instilled that in me, love to travel, or in a line dancing class.
It's fantastic. Dr. Linda Casser, your stories are amazing. Your contributions are appreciated. And I'm so grateful that you are one of those people that created the foundation for the profession. I know you do it with a great amount of humility as we talk about these stories, but you've made, welfare of the public at the center of everything you've done. And I'm grateful to have had you as my guest on this episode of Sandbox Stories. Thank you.
Well, I'm truly honored, Scott. Thank you for all that you do, and just truly appreciative of this opportunity to reflect and to share some perspective. So I'm grateful to you. Thank you.
You're welcome. And to the audience, thanks for attending and paying so much attention to Dr. Casser's many stories. Until my next Sandbox Story, be great at all you do.